Hi, I'm Rick McGuire. I'm the executive editor of CardioSource World News. I'm with Dr. Michael Permenko, and the past president of the Colorado Medical Society. But more important than that, the Grand Junction experience, something that has worked, and it's worked now for years. Let's first go back a little bit. What is the Grand Junction experience?
Well, Grand Junction is an excellent example, Rick, of a community of physicians that actually took a leadership role in how their community's healthcare system was functioning, not taking a back seat, not following, not waiting, and saying, we're gonna do something about this. So the physicians actually started way back in the 1970s, a nonprofit, privately run health insurance company, and stayed nonprofit through the years despite offers to go otherwise. And because of the alignment that we have with that payer, because of the alignment we have with some nonprofit hospitals in our town, we've been able to accomplish some things that other communities just haven't been able to do. Whether that's a fairly integrated system that performs at a high level, but obviously through the literature that's been shared that's made us famous, the cost factor, which is so incredibly important. And because of the quality at a lower cost, we've gained national recognition. And there's some ingredients that we can talk about that made that happen.
That would be what I'd like to chat about, yeah, the ingredients, because so often you think about the fact that, you know, you want all this quality and you want us to cut the prices. You know, you can't have one without the other, but can you?
You can, and you do it by being very honest with yourselves and collecting. You've had talks about data, and collecting your own data, and following that to the place that it needs to take you, which is a quality, lower cost avenue. But you have to be willing to go to that place and analyze that data, and not be shy about talking to your physicians when the data shows that something needs to be changed.
When something needs to be changed, how do you address that with a physician? Because they're going to throw up every barrier into the sun going, oh, well, this is the way we do it around here.
Trust. And that's why having your own data is so incredibly important. If you don't have the trust, then the physicians aren't likely to listen to you. If you're collecting your own data, there's a certain level of trust in the data. And then you can make changes. If a payer brings you data or a hospital brings you data and they don't have that trust, how much involvement, how much engagement are you going to get from the physicians to make the changes that are being requested? And we've seen that you don't get that much. But if you have your own data and the data is shared amongst the IPA, amongst the physicians, who's really expensive relative to quality and who's not, you can really start making some gains. And we've been very transparent with ourselves over the years on peer review and looking at and trying to be very transparent with quality and cost.
Now, we have to admit that Dr. Permenko and his group has had, 30 years to kind of build this out. Now we're talking 3 to 5 years, maybe max, when changes have to be made. What can we start doing now to move in that direction and take those lessons?
Excellent question, and this is imperative, especially if physicians really want to stay independent, or if they simply want to leverage for the best possible position here in the next 3 to 5 years. Because government and private payers are coming to us with value propositions and saying, we want value, we don't want volume. And so if we're going to answer that call, if we're really going to answer that call, we have to organize around our data. And there are some things that are aligning here. Whether you like the Affordable Care Act or not, Obamacare or not, there are a couple things in there that potentially can help you. There's some provisions with the accountable care organizations. One of my favorites, though, is, and very few physicians know about it, and it's Section 1322, the cooperative co-op plan, which there are funds in law that allow physicians or other organizations to set up a nonprofit, privately run insurance company, like we've had in Grand Junction for 30 years, but now the funding opportunity to get that done. And they want to have at least one in every state of the country.
If somebody wants to learn more about the Grand Junction experience, what could they do?
Well, they can
Medline it?
Exactly. Well, there's another, PBS is going to be running a show in February on the Grand Junction experience as it relates to actual American models. Lynn Nichols, who's worked for the, who's talking here this weekend here at the conference, has lessons learned from Grand Junction. He's actually written a piece about the lessons to be learned from Grand Junction. But it really shows what can be done, and I can give you some more resources that you can share with listeners as well on how to read up more about Grand Junction. But really, it's about responding to your community. And it's really, because this is going to be different in every community if it's done correctly. So the Grand Junction experience, you can't just template it and move it to another city. What the message is you got to be leadership in your own community, and you have to respond to the cost equation. We can't just be doctors anymore. We do have to be we have to be economists too. And if we're going to have the leverage that we want moving forward, and if we're not, to some degree, economists second, doctors first, but we need to be economists second, then we're not going to have the leverage that we want as these payment models form.
Thank you very much. I have a feeling we'll probably be talking to you again and again for the next year or so. Thanks, Dr. Permenko.